First of all, we'll give the floor to Madam Zhou Lixing to introduce on the prevention control of coronavirus pneumonia in the city of Huanggang. Dear friends and friends, good evening. Thank you for your interest and concern of the novel coronavirus pneumonia in Huanggang City. And altogether, we have reported 726 cases. 17 were discharged, and there are 14 death cases. Right now, 695 are hospitalized, among which 19 are in critical conditions. 6,300 have been under medical watch, and right now, still 5,600 are under medical watch right now. And since the outbreak, the provincial leaders, including the governor, Mr. Zhang Chaoliang, has been following closely the updates and movement of our control and prevention of this pneumonia, and we have kickstarted the level 1 emergency response in order to coordinate work in all fronts. First of all, spare no efforts to treat the patients. We have established a panel of experts in the medical institutions, and we have conducted training for 10,000 professionals, and altogether we have organized a large number of nurses and doctors to participate in treatment. And the clinics at the county and village level also have opened up 24 o'clock clinic, and altogether we have now 29 designated hospitals with more than 2,200 beds. In order to address the lack of capacity, we have renovated the medical center of Dabieshan into an infection hospital that provides more than 10,000 beds, and we provide individual treatment plan for our patient, for each patient. And altogether, we have received a lot of help from the outside. Altogether, 540 medical staff from the outside province have participated in the prevention treatment of this disease. And altogether, 70,000 party members have been participated in this work, and we prevent the spread and output of the epidemic, and carry out a collective prevention and control, and discover the fever patients number amounts to 4,700. And since the 25th, we have kickstarted the traffic control at the city and have established a mechanism of prevention and control. We have conducted house-to-house interviews and sterilized the vehicles inside the city on a daily basis. And we pull all efforts to stop the epidemic from further spreading. We also try our best to ensure the founding of this disease. Altogether, we have allocated more than 400 million RMB. We have also opened up green channels to expedite the transportation. And currently, the water supply, electricity, and post service are all in normal in order to guarantee the sufficient supply of daily necessity and grocery. Altogether, we have received more than 300 million yuan in assistance. We were promised to use this part of the foundation to where it is most needed. And we would make sure there's a very transparent process in terms of handling and arrange these donations. All of the supervision bodies in our province have sent out more than 400 personnel to check up key locations and handling the malpractices and 6 cadres were dismissed of their position because of their incapabilities in work and malpractice. And we were actually very poorly prepared, and a lot of the cadres are not capable enough to cope with such a big emergency. First of all, we lacked the capacity in terms of medical ability, medical capacity. We have renovated a lot of medical institutions, but they take time. So the categorization part of the medical institutions is not sufficient enough. There's still risk for cross-infection, and we're in dire need of N95 masks, protection suits, as well as mask screening. And in the rural area, we're still lacking personnel in terms of the screening of the population. Part of the rural residents lack the awareness of prevention and control, and we also lack measures in terms of protection and prevention. Coming up, we will act upon General Secretary Xi Jinping's important instructions and remarks on the prevention control of the epidemic, and assume our responsibility for our people, and strengthen administration, strengthen prevention on key populations and groups. And for the cadres who cannot do their job, we will punish them according to relevant regulations, and try our best to admit the hospitals, admit the patients, and use the best resources to treat those in critical conditions. We will also avoid cross-infection in medical institutions. We will also strengthen the prevention control in rural areas to cut the channel for the spreading and dissemination of this virus, strengthen monitoring and clinic sterilization. And we will also procure the most needed resources, open up green channels and facilitate and expedite the arrangement of the medical materials. We will also be disclosing the information in a transparent manner, lead the residents to protect themselves, to eradicate the unnecessary panic emotions, to form a synergy. We also accept all criticism from the media as well as all walks of life. We will be taking more effective measures to implement this policy in order to win this battle. Thank you. Thank you, Madam Qiu Lixing. And now we will give the floor to Mr. Wu Haitao to brief you on the situation of the city of Shaogan. Since the outbreak, the city of Shaogan and the municipal government have acted upon General Secretary Xi Jinping's remarks and instructions, and do our work around the center of preventing the spread of the disease inside and prevent it from spreading to outside of provinces, to the other places. We have altogether issued 13 orders, and it's an integration of prevention, control, and reduction. In terms of prevention, we have the leading teams that identifies the responsibilities of our cadres at different regions to do screening, supervision, and it has become a very effective working mechanism through publicity and broadcast on the media and slogans and notifications in the communities. We have strengthened the publicity and the knowledge of this disease in a very effective manner. Since the 21st, in critical traffic junctures, we have set up a checkup point In villages, in living quarters, and communities, all of the access have been closed. And we will prevent this kind of collective activities from taking place, and which we also practice daily sterilization and to limit people's travel outside their living areas. We also have kickstart this organizational committee. The commanding center that used to be in charge of poverty reduction is now changed into a commanding center for prevention control of this epidemic. In each village, we mobilize all of the cadres into working teams, altogether 29 teams. We mainly do the screening of the returnees, especially those from Wuhan. For those with a fever, we compel them to stay home for medical observation. And if necessary, we would admit them in hospitals for further medical observation treatment. We give a priority to the health of our people, and we have set up 3 fever clinic and 9 designated hospitals, and set up a special zone for observation and try our best to admit more patients and to build the so-called 3 zones and 2 channels. For those close contacts, the doctor on call must keep them for observation. We also have mobilized medical resources, identify the responsibility of the testing institutions. We resort to Huada Genes Company for the scientific testing of these cases. Currently, we can handle 400 cases in our city on a daily basis, which is a major improvement in terms of the speed. We have also organized a panel of experts to do scientific research and improve the efficiency of diagnosis. We also have arranged the medical workers to stay in nearby hotels to ensure that they can rest well. According to the national standard, we have also made careful calculation of the statistics, and no cover-up is allowed in our city. And we have also do daily accumulation of the medical resources that is needed, and arrange these materials according to the need. We are trying our best to make sure to conduct scientific deployment and make sure that the materials can go to the place where they are most needed. We have opened up green channels and arranged 252 vehicles to guarantee the prevention control and the traffic and the transportation of daily necessities. We have also strengthened market management and administration. We held 2 press conferences to disclose the information and reply to the most needed questions. And we are keen to encourage and involve the entire society and our people in this effort. So far, we have altogether 1,095 suspected cases and 628 confirmed cases. It is still growing on a daily basis. And coming up, we will reduce social mobility to the minimum and continue to implement our prevention control measures, as well as the transportation of medical materials, and make sure that all the close contacts are compelled to stay at home for medical observation. And we will pull on all resources of our city to fight and win this battle. Thank you, Mr. Wu.
请媒体提问。
Now the floor is open to questions.
请介绍一下自己所在的。
Please identify yourself before raising the question.
你好，新闻广播湖北之声提问。
With
上海市在短
Hubei's
时间内
voice,
疑似病例和确诊病例上升都很快。
the
那请问
suspected
是否存
cases
在
and confirmed cases in the city of Shaogan is rising sharply. So is there a danger of major outbreak in the city of Shaogan? Indeed, recently, we've witnessed a sharp increase in terms of suspected cases and confirmed cases. The reasons are as follows. First, the potential incremental cases is relatively large. Shaogan is a small city with a lot of connections with the outside regions. So, first round, we have screened altogether 5 million people citywide, among which about 50,000 of them are Wuhan returnees. So we also have a standard in terms of the testing. In order to achieve the goal of stop the spread inside the city and stop the disease from spreading further outside the city, we have major indicators. The first is the incremental amount, and second is the additional amount. In terms of incremental, we have set a goal that after the level 1 response was kicked off on the 21st, in the longest incubation time, that is 14 days, it will be diagnosed on February the 5th. If we can discover these cases within these 2 weeks, this case will be identified as an incremental case, and what comes after that will be identified as additional case. So right now, most of the counties are working on this 14-day window as a window to dismiss, as a window to release this kind of incremental cases. Because in the first period, in the earlier period, we still lack ability, especially in terms of the diagnostic tests. Therefore, prevention and treatment is our main storyline in terms of fighting this disease. So we have transferred the poverty reduction mechanism into the system of prevention control of the epidemic. So altogether, we have more than 2,500 working teams that has been working in each villages and counties. I think that's one of our advantages. And third, in terms of diagnostic testing, we have been improving the efficiency by leaps and bounds. We mainly have 2 institutions to do the testing. First is our central hospital. Another is CDC. And in recent days, we have purchased more machines to do the testing, and the capacity has been quadrupled in the past few days. A person, when developing from a fever patient to a suspected patient to a confirmed patient, it takes some time and takes requirement. You have to do this kind of epidemiological investigation. We have to see what temperature are you at, and we need to do the radiology and exclude other pathogen, and to do the consultation. In order to expedite this process, according to the national standard, we have expanded our scope of testing. For all of the patients that are kept for observation in fever clinic, they will be included as a subject of the testing, and that it's a major increase in terms of testees. And the percentage of suspected to confirmed cases used to be 38%, and right now the confirmed cases only account for about 18% of the suspected cases. The number seems to be growing rapidly, especially when it comes to the suspected cases. This is because we are pulling all the resources to expedite the screening. It might cause some concern in our society, but I think it means that we are getting the risks under control. And with the improvement of our testing capacity, after these suspected cases would have to go through 2 nucleic acid tests in order to confirm. I think as time goes by, we will eventually see the downward trend of the suspected cases as well as confirmed cases. What is the situation of the adequacy of medical resources in the city of Huanggang? Thank you for the question. This is the most urgent and worrisome problem that we are faced with right now. Our frontline medical workers must do their work in the wards, and they are lacking basic protections in terms, including N95 and protective suits. To make up for the gap, we have established a materials and logistic team to address this problem. As I have introduced, we have allocated more than 400 million RMB to guarantee the procurement of the most needed resources. The commanding center in our city also have procured 390,000 pieces of materials. In the designated medical institutions, they have also done some procurement of the instrument as well as drugs, but this is far from enough. The provincial government also attached great importance to the situation in our city and have allocated more than 800,000 masks and 52,000 protective suits. And the famous mask manufacturer Winner Medicine is right now producing in full capacity. On a daily basis, they can produce 36,000 N95 masks. 24,000 of the masks can be suitable for medical use. And a lot of our compatriots in other cities and other provinces are making donations, and altogether we have received 335 million yuan worth of donation. Despite all of that, as you can see, the confirmed cases in Huanggang has amounted to 726, so we are still in dire need of medical resources. And we have been prioritized, and our highest priority is our medical workers. For all of the resources allocated our way, we will do speedy reallocation and use them where they're most needed. After we have expedited the diagnostic process, I'm sure the confirmed cases will continue to rise. and we will have an even more desperate need for medical resources. But our working group will be pulling all resources possible to to accumulate these materials, and we will also welcome donations both domestically and from outside the country. So the provincial leaders also, as I said, attach great importance to the prevention control of our city. So we will try our best to make sure that our medical workers at the front line can have access to the protection they need. So I call on to, through our media, to the public to help us with donation or with information of procurement. Those your help and assistance are crucial to us.
好，请这位女士。
谢谢，我是央广记者，我也是一名校长。
With CMG and CNR, my question goes to Mayor Wu. How do we guarantee the supply of medical resources and how to make sure of the accurate deployment of these resources? Since the outbreak, everywhere we're running out of medical resources. So the whole country have been motivated to help us and to do the deployment of the materials well. On the 27th, the commanding center have set up a materials a logistic team that involves work of such as procurement, allocation, and donation. And so far, through procurement, we have altogether received more than 47,000 N95 and 50,000 KN95 and 1.5 million general use medical masks and temperature checkup 12,000 and 70,000 bottles of disinfectant and 22,000 protection suits and 10,000 disposable caps, and altogether we have received 200 million yuan worth of donation. So we are still having a large gap in terms of medical resources supply. In 5 days, the gap amounts to 32,000 masks and 8,000 protection suits, 26,000 protection masks and screen. In order to use these limited materials in the place that where they're needed, we have established a mechanism to first give priority to the protection of the medical workers. So it's an isolation statistics between the hospital as well as the society. So we have a daily report system in terms of resources, and the most direct and these resources and numbers will be reported directly to the commanding center. The resources, including N95 and protection suits, are making sure that these resources goes to frontline medical workers, and right now we can achieve a tight balance of about 2 days. We have also acted upon, according to the guidance issued by the National Health Commission in terms of the utilization of medical resources for gloves, protection screens, isolation suits, and protective suits. It has very clear identification and introduction of the utilization of these resources. And we act upon this guidance and make sure that all of these materials are used to their best value. We have also coordinated the allocation of the resources. And in all walks of life, the administrator will have to report to us a situation in our department in a timely manner. With Hubei TV, a central supervision team have been inspecting the work in the city of Huanggang, and problems were discovered in the process. So how do you guarantee the efficacy of your work and capabilities of your local cadres? Thank you for the question. 2 days ago, CCTV have uploaded a video on the situation when inspection team came to the Health Commission of Huanggang. I sincerely thank your criticisms and supervision of our work. The problem discovered is actually great support for us to do our future work well. Currently, we are facing daunting tasks in terms of the number of confirmed cases, and we are the second most affected city other than Wuhan. So it's our most dire responsibility and duty to safeguard the health and safety of our people. The problem exposed have been a clear testament that we have a lot of problems in our work, and some of the cadres are not capable enough to do their job. And so we felt very guilty, and we blame ourselves for exposing these loopholes in our work. The city committee and government have held emergency meetings to dismiss some of the incapable cadres, 3 at county level, and 3 more in other levels. And currently, we have carried out the disciplinary punishment to about 202 cadres in the city of Xishui and Hong'an. The cadres were asked for conversations to see to it that they have to do their work well, especially as the major cadres of one region. This shows our determination at the city level to win this battle. After the exposure of these problems, we will try even harder to undo our mistakes and use them as an example to motivate us and urge us to do our work better. We have to make up for the gaps. And first and foremost will be the lack of hospital beds. We have expedited the process of renovation and construction, and right now the hospital beds have increased to 4,200 in the city area. There are altogether 1,200 beds to admit as many patients as possible. And in terms of the observation, we need to strict our process, our procedures. And third, faced with the severe shortage of medical resources, we will optimize our system to direct these resources to the places where they're most needed. And fourth, is to make sure that the designated hospitals and isolated hospitals are monitored closely 24/7, And we also have attended to the problem of long waiting line and long waiting time. Rural area and community are the weak links in terms of prevention and control. We have also strengthened the prevention measures of the medical workers. As I reiterated just now, our number of confirmed cases is still growing, but we are actually a poverty-stricken area with poor medical infrastructure. So right now we are faced with such a daunting task, despite the fact that our medical workers are pulling all of their endeavors for the treatment. But the shortage of N95 masks and protective suits have constituted major challenges for our work. Protection of the medical workers is our first priority. We would also improve the publicity of this disease, of the relevant knowledge, so as to strengthen their awareness of protection. We must also discipline ourselves, and the supervision teams were sent to government organs of all levels in order to act on the deployment. If there is a malpractice and inaction on the part of the local cadres, we will punish them according to relevant laws and regulations. So we are determined in the end to win this battle against the epidemic. We welcome all kinds of criticisms, suggestions, and your insights that comes our way. We will try our best to fix them as soon as we can.
人民日报记者，
With 人民 Daily.
湖北省其他市州并列一些医疗
Besides the city of Wuhan, can you brief us on the prevention control in other regions of our province? That is a very important question. Since the 27th, in the Shenongjiao forestry area, they reported the first case, and by then, all the 17 cities in our province have reported their cases. So altogether, the amount of cases reported amounts to 7,153. The confirmed cases outside Wuhan have now accounts for more than 50% of the total confirmed cases. And in several cities, they have reported more than 100 cases. In city of Huanggang and Shaogan, they have reported more than 600 cases. Compared to the city of Wuhan, the other cities are lacking in terms of their medical capacity and infrastructure, which constitute a daunting task ahead of us. We first of all need to build their capacity. Since the 31st of January, outside the city of Wuhan, we have established altogether 220 designated hospitals, and we have done renovation of these hospitals and expedite this renovation in the process by renovation and reconstruction. We have also contacted the hotels nearby to use them as location for medical observation and isolation. Currently, beside the city of Huanggang, the other cities are also building a specialized hospital, many of them in the model of the Xiaotangshan Hospital. We also need to improve the level of service, namely to standardize the treatment and diagnosis, to strengthen training of the medical staff, and strengthen procurement in terms of equipment and drugs. We are right now trying to purchase negative pressure ambulance and ventilator, as well as ICU, construction of ICU ward. The third aspect is to improve the synergy. We have to mobilize all of the available resources and put them into the collective treatment. We have also received more than 17 medical teams to carry out work in all of these cities. More than 595 came to the city of Huanggang, and more than 400 came to the city of Shaogan. It has greatly strengthened the capacity, medical capacity in these places. We also need to strengthen guidance. According to the arrangement of the Provincial Commission, the 14 provincial level cadres are in charge, are responsible for a city respectively. We have also sent out working teams in guidance of the treatment diagnosis work and help them to address the existing problem in order to improve the capacity and strength of local government.
你好，中国日报记者提问，我们想了
With
解一
China
下
Daily,
出现确诊
we
的
would like
大
to
幅增
know
加，在这种情
we
况
saw
下，
a sharp increase in terms of number of confirmed cases, so what are the countermeasures against that? In the past 3 days, each day we have a increased confirmed cases of more than 1,000. That is higher than 1,000, which is quite high. The major reasons are as follows. First is that the patients in incubation began to show their symptoms. The coronavirus can have a incubation time as long as 14 days. Since the 23rd, we have taken measures to restrict the mobility of our population. However, before that, many of the patients were already infected and they are undergoing incubation time. In the early stage, they might just show slight symptom. Get screened. We have mobilized the capacity of the grassroots party organs and to depend on community level clinics to do this thorough screening of the fever patient. We have strengthened our effort of screening, and Huanggang and Shaogan actually have a lot of experiences. In the past, people may not care if they have a little fever, but right now, people's awareness have improved, so more of them are willing to seek medical help. Right now, we are at the 4th edition of treatment and diagnostic plans. If you show symptom of coughing, fever, and pneumonia, you are identified as a suspected cases. So the process has actually been streamlined. And if your nucleic acid test show positive result, you will be diagnosed as a confirmed case. And fourth is that our capacity of testing has been improved. Since the 27th, we have received more than 200,000 PCR kits, and 78 medical institutions, CDC, and third-party organizations have been conducting nucleic acid test, which is a major improvement in terms of our ability to do the test. So that might answer your question of the sharp increase in terms of suspected cases and confirmed cases. As for countermeasures, we must, first of all, control the sources of infection and make sure that the patients are admitted as soon as we can. For suspected cases and close contacts, they must be isolated for medical observation. For the confirmed cases, must go to the designated hospital for treatment. Second, we mobilize medical resources and we have allocated and renovated hospitals and hotels for medical observation as well as treatment. We also have optimized our treatment plan, and we have been leveraging the advantages of both traditional medicine as well as Western medicine, and the TCM has been used as a major source of treatment, and multiple academicians have participated in this process. We are trying spare no efforts to guarantee the supply of the medical resources, but as I mentioned, we still have a lot of pressure in terms of the supply of medical resources. There's still a large gap, so we call out to the society to continue to support us in these regards. With Hubei government and its affiliated website, I think now implementation is the key. So does the city of Xiaogan have any measures to implement the instructions from above? This is actually a very abrupt fight against the epidemic. This is a major test of our capabilities, our consciousness, and our ways of conducting our work. The central government, the provincial government, and the experts' opinion are quite clear. But implementation, the devil lies in the implementation. We must, first of all, play the leading role in this. The 3-level leaders in our city must do the contracted work in order to supervise the prevention treatment at different levels. The cadres will have to go to these community and grassroots and villages. And altogether, we have organized working teams with a total number of 24,000 cadres and 219 teams of more than 2,500 cadres were organized to carry out contracted inspection in designated area. Second is to make the rules. We have issued documents as a guidance for the behaviors of our cadres. And third is we strengthen the supervision checkup of the work, and we carry out very strict liability mechanism. We have already handling 13 cases and have held 43 personnel accountable. We have been receiving actively the criticism of the media. From the 22nd, we kickstart the level 1 emergency response, and now 10 days have passed. I can give you a brief on what we have done. We have checked up 5 million people and have screened more than 11,000 patients and have identified more than 1,000 suspected cases and have discovered 628 confirmed cases and have done more than 3,000 PCR kits, diagnostic testing. We still feel that our socialism system has its advantage in these difficult times. We have a lot of touching stories. One of our medical workers in a central hospital, Tian Qiu'e, is in her 80s. She insisted that she work in the infected patient area, and she said that we have a lot of young doctors and nurses. They are not afraid. Why am I afraid? And I'm also a party member, so I must be here to contribute. And we have 2 cadres on the January the 2nd of the lunar year. He had died in his position. He's only 49 years old. 10 p.m. today, one of the secretary in a village also died at the age of 58 in his position. So my highest tribute goes out to all of the medical workers and frontline workers that is fighting this epidemic. A question goes to Ms. Qiu Lixing. We have Huanggang is the 2nd largest city with more than 7.5 million population. So what have you done in terms of the grassroots prevention control? The grassroots is first defense line of this epidemic. The city of Huanggang is the 2nd largest city after Wuhan, and also a poverty-stricken area and a revolutionary old region. It is very close to the city of Wuhan, only 1 hour on the way. Before the shutdown of the city of Wuhan, about 390,000 people have gone out to the other places in Hubei province, and according to our estimation, about 600 to 700,000 people have migrated from city of Wuhan back to Huanggang, which constitutes a major pressure for us because the incremental number is huge. That's why we see a sharp increase in terms of our numbers. Many of them are potential virus carrier. Some of them still in incubation, turning from a fever patient to suspected cases and then to confirmed cases. So we must strengthen our capacity of testing. Now we still have 1,000 suspected cases, and after the diagnostic kits are finished, I believe large percent of them will be confirmed. So today and tomorrow, we are expecting an increase in terms of confirmed cases, because the confirmed cases is a number of confirmed cases and incremental cases is so big. So it is crucial for us to control this trend. After the cases were confirmed, they must be admitted into a designated hospital, and we also need to prevent spread and transmission. First is thorough screening, to build a system at the village level and door-to-door screening and registration. I myself also went to Hubei and the Longgang village to do inspection. I think the grassroots level workers are now fully mobilized. For all of the returnees, they have registered their names, their telephones. Especially the Wuhan returnees are the key population. Once they show symptom of fever and coughing, they will be sent to the village clinics for further checkups. If the situation deteriorates, they will be sent to these city-level clinics and medical observation if needed. These are key population, as I said, and we have also prioritized the Huangzhou returnees. On a daily basis, they need to check their body temperature twice. Second is the overall administration. On the 23rd, after the shutdown of the city of Wuhan, the city of Huanggang also have made a decision to close down the city. We have conducted traffic control in order to stop the dissemination of the coronavirus. We have identified 6 social activities that will be shut down and oblige people to wear masks. And we forbid all returnees from conducting outdoor activities and cancel all kinds of parties and visits and gatherings of our population. And we have also conducted thorough traffic control inside the city and in all main roads of our city. We have also set up checkpoints to do body temperature checkings. Third is to tighten the measures in terms of sterilization in living quarters, elevators, garbage stations. And at the village level, we also have set out plans to cut out the sources of pollution. And we have also conducted comprehensive publicity. In rural areas, we use these loudspeakers and even drums to do publicity and knowledge dissemination, so that we make sure that each household and people are aware of this situation, and they must be protecting themselves well. We have also urged that the party organs at grassroots levels and all of the 170,000 party members be participating in this movement, so as to make sure that these measures are fully implemented in these villages and in each household. The rural areas are the weak link to the prevention control, and Governor Xiang Chaoliang and the other provincial leaders paid visit to the city of Huanggang, pointing out that in Huanggang we have a vast area of farmland and villages. So coming up, we will act upon the provincial and the instructions of the central government and continue to specify our policies so as to build a strong defense line against the dissemination of this disease. Last question due to time limit.
是湖北日报的记者。一线医护人员的后勤保障问题一直是大家关心的。
With Hubei Daily, the protection of the frontline medical workers is a priority in our work. So, what measures have you taken? Thank you for the question. In this battle, the medical workers are our first defense line. They are treating this patient, fighting this disease, and with their own life. They're making major contributions to our efforts of fighting this disease and this coronavirus pneumonia. So my highest tribute goes out to all of them. In order to better protect the safety of our medical workers so that they can better involve themselves in their work, documents have been issued asking that the localities must guarantee work in this regard. First of all, we ask that the supply of medical resources giving priority to these medical workers. We have also allocated the financial budget to do this, both in their work and in their living and accommodation. There are effective measures to protect the interest of the medical workers. We will make sure that they have sufficient rest, and we'll give them free physical checkups and give them their dual vacations after this epidemic has passed. And we'll also provide them with psychological consultation services, and we'll take measures to take care of their children and elder member of their families. For the medical workers who unfortunately are infected during the treatment, And we would provide them with working insurance compensation. And we would give them a one-off subsidy of 6,000 yuan per person. And on a daily basis, they will receive a subsidy of 200 to 300 RMB. And that is also allocation of financial budget. We also provide them with the awards to reward those who have made remarkable contributions in this regard. And we also provide them with preferential supporting policies in terms of the promotion process. We'd also urge the governments to strengthen publicity and report the stories of our medical workers. For those who have made major contributions, and we will give them timely rewards, the provincial government would also strengthen our work in this regard. I believe the full society is in strong support of our medical workers, and in this way we can form a synergy to fight and win this battle. That's the end for today's press conference. I want to thank the speakers and the friends from the media.